Hand, foot, and mouth disease, or HFMD, is a common illness. It's caused by a virus and usually affects young children. Kids under 5 years old are most likely to get it. Older children and adults can get it too, but it's less common. HFMD spreads easily, especially in schools and daycare centers. It can spread through close contact with an infected person or through coughing and sneezing. HFMD is usually mild, and most people recover within 7 to 10 days. Symptoms can be uncomfortable, but serious complications are rare. HFMD, or hand, foot, and mouth disease, often starts with a fever. This is usually the first sign that something is wrong. The fever can be mild or quite high, and it often comes on suddenly. Parents might notice their child feeling warm to the touch or acting more irritable than usual. Along with the fever, a sore throat and a general feeling of being unwell and tired are also common early symptoms. The sore throat can make swallowing painful, and the fatigue can be quite overwhelming, causing the person to want to rest more than usual. 1 or 2 days after the fever begins, painful sores may start to appear in the mouth. These sores can be very uncomfortable, making it difficult to eat or drink. They often start as small red spots that blister and can become ulcers. These sores can be found on the tongue, gums, and inside of the cheeks. They can be quite painful and may cause significant discomfort, especially when eating or drinking. A rash may also develop, made up of small red blisters. This rash can appear on various parts of the body and is often itchy and uncomfortable. These blisters can be painful and usually appear on the hands and feet. They can make walking or using the hands uncomfortable. Sometimes they can also appear on the buttocks, adding to the discomfort. Not everyone with HFMD will have all of these symptoms. The severity and combination of symptoms can vary widely from person to person. Some people, especially adults, may have no symptoms at all, making it easy to spread the virus unknowingly. It's important to be aware of these signs to help prevent the spread of HFMD. HFMD spreads through close contact with an infected person. This includes contact with saliva, fluid from blisters, and stool. The virus can also spread through the air when an infected person coughs or sneezes. Tiny droplets containing the virus can travel through the air and infect others. You can also get HFMD by touching surfaces contaminated with the virus like toys, doorknobs, and countertops. If you touch a contaminated surface and then touch your eyes, nose, or mouth, you can become infected. Section 4. Diagnosis and treatment of HFMD. Hand, foot, and mouth disease, commonly known as HFMD, is a viral illness that primarily affects young children. It is characterized by fever, sores in the mouth, and a rash on the hands and feet. A doctor can usually diagnose HFMD by examining the rash and sores. The distinctive appearance of the rash, along with the presence of sores in the mouth, often makes it easy for healthcare professionals to identify the disease. In some cases, the doctor may take a swab of the throat or a stool sample to confirm the diagnosis. These tests can help rule out other illnesses and ensure that the correct treatment plan is followed. There is no specific treatment for HFMD. Since it is caused by a virus, antibiotics are not effective. Instead, the focus is on managing symptoms and providing supportive care to help the patient feel more comfortable. Antibiotics do not work against viruses. They are only effective against bacterial infections, so they won't help in treating HFMD. The illness usually goes away on its own within 7 to 10 days. During this time, it's important to ensure the child gets plenty of rest and stays hydrated. Treatment focuses on relieving symptoms. This can include measures to reduce fever, alleviate pain, and soothe the discomfort caused by mouth sores. Over-the-counter pain relievers can help reduce fever and pain. Medications such as acetaminophen or ibuprofen are commonly used to manage these symptoms. It's important to drink plenty of fluids to stay hydrated. Dehydration can be a concern, especially if the child has a fever or is not eating and drinking well due to mouth sores. This is especially important if you have a fever. Keeping the body hydrated helps in the recovery process and prevents complications. Section 5. Preventing the spread of HFMD. Hand, foot, and mouth disease, commonly known as HFMD, is a contagious viral illness that primarily affects young children. However, it can also spread to adults. Understanding how to prevent its spread is crucial for maintaining a healthy environment. The best way to prevent HFMD is to practice good hygiene. Here are some essential tips to keep in mind to protect yourself and your loved ones from this illness. Wash your hands often with soap and water. This simple act can significantly reduce the risk of infection. Make sure to scrub all parts of your hands, including between your fingers and under your nails, for at least 20 seconds. This is especially important after using the toilet, changing diapers, and before eating or preparing food. Proper hand hygiene is a key defense against the spread of HFMD. Avoid close contact with people who are sick. This includes not only physical contact but also sharing personal items like utensils, towels, and cups. This includes kissing, hugging, and sharing utensils. Disinfect frequently touched surfaces regularly to kill any lingering viruses. This includes toys, doorknobs, and countertops. Regular cleaning with disinfectants can help eliminate the virus from surfaces that are commonly touched. Stay home from school or work if you are sick. This is crucial to prevent spreading the virus to others in your community. This will help prevent spreading the virus to others. By isolating yourself when you are unwell, you protect those around you from potential infection. By following these simple tips, you can help prevent the spread of HFMD. Remember, maintaining good hygiene and being mindful of your actions can make a significant difference in keeping everyone healthy.